So, last session of the day, the international session, and this is a number of talks from various people across the globe, starting with a really very important contribution from Ross Andrews. Ross Andrews, who's been involved in cholangiocarcinoma from Thailand for very many years. Maybe you'll tell us exactly how many years, Ross, but very many years, and is also based at Imperial. This lecture is about Narong Khuntikeo, who was absolutely the figurehead for research into cholangiocarcinoma in northeast Thailand and Laos and I think you call it the Mekong Basin, and he pioneered this. He was this outstanding figure in this area for ages. He recently passed away. Ross is going to tell us all about it. Thank you, Ross.
Thanks, John. Good afternoon. Sawasdee krap. I'm going to talk about a can of worms, basically. But this has been a difficult task. Difficult because I did not know where to start to acknowledge a very dear colleague and, above all, my friend. So I've decided to start here. That's Narong there. At the Khuntikeo family restaurant, where Narong's vision and mission to effectively combat and eventually eliminate liver fluke-related cholangiocarcinoma started many years ago when both his parents died of Opisthogus viverrini-related cholangiocarcinoma, at which time he planted the trees at his family restaurant. Albert Einstein once remarked, "The value of a person should be seen in what they give and not in what they are able to receive." Narong exemplifies this through his lifelong dedication to help increase the life expectancy and quality of life of millions of people in Thailand and other Southeast Asian countries. Narong was a catalyst for the evolution of ongoing multidisciplinary research collaboration between KKU and many other institutions extending regionally and internationally. I've known and worked very closely with Narong for many years, and I've seen the kind and empathetic, quiet way he engaged with his patients, his students and his colleagues, listening intently to their concerns and aspirations in a calming and most sincere way. Similarly, when giving advice. This is Narong with his wife Nantaka and their daughter Nancha, who's continuing with the Khuntikeo tradition by commencing a fellowship and training in liver surgery at Srinagarin Hospital, KKU. Narong was an inspirational natural leader, educator, brilliant surgeon, noteworthy scholar and mentor. I've chosen three significant events and achievements from the many that define Narong's legacy. The formation at KKU in 2013 of the CASCAT, the cholangiocarcinoma Screening and Care Program. In 2019, the Fluke-Free Thailand program was introduced and founded at KKU, which has become a national public health priority and policy. And 2023, the soon-to-be published book, Liver Fluke, Opisthogus viverrini-related cholangiocarcinoma by Springer, with Chief Editor Narong Khuntikeo. The book includes an introduction, and you see things there, Opisthogus viverrini life cycle, distribution, systematics and population genetics, epidemiology and control of Opisthogus viverrini infection, implications for cholangiocarcinoma prevention, the hallmarks of liver fluke-induced cholangiocarcinoma, insight into drug possibility, pathology of cholangiocarcinoma, new imaging techniques, surgery, systemic treatment, palliative care, digital innovations, raw attitudes, socio cultures, altered landscapes and changing perceptions of an underestimated disease, community awareness and education in the West and Southeast Asia, and finally a synopsis. The following is a summary highlighting Narong's keystone and inspirational roles he played in advances made to date and the evolution of a multidisciplinary strategic model that has been implemented to combat Opisthochus viverrini-related cholangiocarcinoma. Comprehensive molecular genetic research has uncovered that the three-host life cycle of O. viverrini is more complex than previously believed. Of significance and importance has been the discovery that O. viverrini is not a single species, but that it is indeed a complex of many species with varying degrees of genetic diversity and differences in population genetic structures found to occur within and between specific water catchment systems. It remains to be determined whether there are correlations between the different species and/or defined genetic groups of Opisthochus viverrini sensu lato with known and varying levels of infectivity, pathogenicity, and CCA incidence. Reduction in the incidence of CCA should be achieved by identifying and reducing the number of people infected with the parasite following eating of partially cooked and/or fermented freshwater fish, which carry the infective life cycle stage. Particularly exciting and significant is the recent development of a urine antigen assay, which has revolutionized the diagnostic approach of opisthochiasis due to its simplicity, the non-invasive nature of sample collection, and its ease of use in field settings. Pebun Sitithorn from KKU will expand on this. A comprehensive conceptual framework has been developed to assist in understanding the complexity of CCA carcinogenesis and biology. Exciting recent research advances are enhancing our understanding of the molecular mechanisms of carcinogenesis and cancer development, which can result in the improvement of targeted CCA therapy in the future. Development in the last decade of imaging techniques has increased diagnostic accuracy, providing reliable information, allowing appropriate treatment and management programs to be selected for each patient. Importantly, training programs have been established at the Faculty of Medicine, Konkani University, for ultrasound screening of cholangiocarcinoma for radiologists and general practitioners, nationally and internationally. Additionally, teleradiology has been established and in use for ultrasound images to be uploaded from public health facilities and viewed by specialist radiologists who provide an expert provisional diagnosis to promote appropriate treatment. Significant inroads and advances have been made in the surgical treatment of cholangiocarcinoma, for instance in preoperative biliary drainage, preoperative endoscopic nasobiliary drainage, portal vein embolization, minimal invasive surgery for CCA, and liver transplantation, to name a few. To achieve these goals, specialist training is required, and as such, a training program has been established in hepatopancreatobiliary surgery at the Faculty of Medicine, Konkani University, which is offered nationally and internationally. Recently, advances have been made regarding the systemic treatment of cholangiocarcinoma, and molecular profiling of cholangiocarcinoma's tumours has resulted in several novel systemic treatments being approved for some cohorts of advanced CCA patients with specific molecular signatures. Advances in the delivery of palliative care have been implemented for CCA patients. A multidisciplinary palliative care team has been formed at Konkani University, which provides the most appropriate multimodal treatment for good quality of life and survival of patients. A sophisticated data collection and analysis system, the ISAN cohort, has been developed and established for treatment and control of cholangiocarcinoma. It represents a comprehensive research resource and a database for scientific monitoring and evaluation, in particular, the evaluation of long-term changes in the liver and bile ducts, determining early detection rates and long-term clinical outcomes in response to various medical treatments. Scientifically sound data can also be assessed as a basis to determine government policy within Thailand, but also in other Mekong countries. A greater understanding has been made of the social, community, religious and anthropological issues directly involved in initiating and sustaining the eating behaviour of raw, partially cooked or fermented freshwater fish. The raw attitudes of people, communities and cultures underpins the continued transmission of Epistochus viverrini and the subsequent development of cholangiocarcinoma. These important issues should be and are being included in food safety and education programs. However, the raw attitudes of a large proportion of the population at risk in Southeast Asia of infection by Epistochus viverrini and resultant CCA still remains. Public health interventions can learn from the development of long-term integrated Epistochiasis control approaches in northeast Thailand and how the three-tier CASCAP model requires multi-scale public health collaboration across provinces, districts, sub-districts and village levels. Specifically designed education programs and curricula targeting school children have been introduced during the past 10 years since the inception of the CASCAP and the subsequent fluke-free Thailand model. It is heartening to discover that the education programs which focus on food safety, raw attitudes and sanitary conditions are reducing the prevalence of Epistochus viverrini infection and the incidence of CCA in school children. The education program is being expanded to other provinces in Thailand and in the near future to other Southeast Asian countries, initially to Laos PDR, where the fluke-free Laos PDR program has already been implemented via Khon Kaen University. The strategic fluke-free Thailand model includes components covering education, food safety, sanitation, reservoir hosts, new diagnostic methods, screening for precancerous changes in the biliary tract and CCA, clinical trials, data collection, collation and analysis, socioeconomic consequences, and health government policy advice. To enhance and sustain the integrated components of this model, a multidisciplinary CCA patient care team has been established at KKU to improve the quality of CCA care. The team comprises specialist nurses, medical oncologists, hepatopancreatobiliary surgeons, radiologists, pathologists, and radiotherapists. To ensure the effectiveness of the team, the CCA Centre of Excellence has been established as a national, regional, and international hub at Srinagarin Hospital, Khon Kaen University. The centre contains 5 dedicated CCA facilities: a CCA ward, an operating theatre, an intensive care unit, a biobank, and research laboratories. This forms the basis for establishing 5 dedicated CCA functions, namely for tertiary referral, training, research, networking, and as a national, regional, and international focal point, thus providing avenues for better understanding and effective dissemination of information, as well as for acquiring specialist skills at all levels to combat cholangiocarcinoma. Additionally, specialist training, principally for hepatopancreatobiliary surgery and radiology, must become an essential public health policy, together with the development of hospital networks and referral systems for effective care of cholangiocarcinoma patients. A comprehensive prevention, screening and early diagnostic program for CCA, as well as efficient curative and palliative treatment programs, must be developed to encompass the differences in patient, family, social, community, ethnic, religious aspects and government health care policies that exist between different regions and countries in Southeast Asia. Despite advances that have been made in many disciplines focused on Epistochus viverrini-related cholangiocarcinoma, raising awareness of cholangiocarcinoma at all levels, particularly across endemic regions, is still needed, as is raising the awareness of cholangiocarcinoma globally. So finally, as parasites and parasite-related diseases have no borders, it is critical that an effective common strategic plan is implemented and established between all countries where Epistochus viverrini-related CCA is a significantly important public health problem, thereby increasing the quality of life and life expectancy of millions of people who suffer from this insidious disease. I would like to conclude with the following. That's Imperial College 2013, where significant international collaboration gained momentum. You'll note some of the players in that slide. The AMMF award was Narong's proudest personal and professional accolade. Thank you to Harry, Noel and Helen. Excuse me. This following slide, wait. This is the last sentence that my friend Narong and I wrote at the end of last year in his office. It is a tragedy that countless people still die and will continue to die. Or you can read it. Preventable and treatable disease. A penny, 1 baht for Narong's thoughts. Perhaps summed up by 6 simple and powerful words. Think big, make big things happen. Thank you.